The APNU-AFC Member of Parliament and former Minister of Health, Dr. Karen Cummings, during her presentation at the 5th sitting of the 12th Parliament, heavily criticized the allocation in the 2020 emergency budget for the health sector. She maintained that with the exponential rise in cases and deaths, contact tracing in all administrative regions for coronavirus must be made a priority.
This COVID-19 pandemic, there must be a coordinated response as health continues to be decentralized. There must be the stepping up of testing, tracking, and treatment of COVID-19 patients in the 10 administrative regions. And the regional bonds must be stocked up with the requisite resources and personal protective equipment, PPE and gear, and the standard test kits.
Pointing to other issues in the health sector, Dr. Cummings also highlighted the need for continued timely screening for non-communicable diseases, such as cervical and colonic cancers, while boasting of the opposition's ability to reduce the country's high suicide rate.
On our taking the reign of office in 2015, we inherited a suicide rate of 34.7 per 100,000. But by 2017, the rate was 24.63 per 100,000. By 2018, the rate fell even more, 18.88 per 100,000. Thus, the evidence shows that the APNU-AFC coalition government utilized the correct approach to lessen the suicide rate.
The minister further critiqued provisions in the 2020 budget, which outlines that through a partnership with iCare Guyana, as much as 1,500 visually impaired persons will have access to glasses. She acknowledged that several organizations supporting persons with disabilities have not received any increase in funding.
But, Mr. Speaker, in this budget 2020, there is no increase of funding to the iCare Guyana project, which has been brought now under the Ministry of Public Health Program on Disabilities after the funding was exhausted in 2019. There is also a decrease in funding to both the National Commission on Disability and the Tolman Reed Rehabilitation Center.
She noted, too, that while the government plans to remove corporate tax on private healthcare as well as VAT and medical supplies, mechanisms should be in place to root out the presence of fake drugs on the market and ensure efficacy in the drug supply chain. $51.7 billion has been allocated by the government to the health sector to improve past programs, procure drugs and medical supplies. The government has outlined its intentions to complete the Smart Hospital initiatives, which was referenced by Dr. Cummings at Diamond, Parmakatoy, Mabaruma, Leonora, and Lethem. The Smart Healthcare Facilities Project, which was launched in 2019 in collaboration with the Ministry of Public Health and the Pan American Health Organization, as well as the United Kingdom, entailed the retrofitting of health facilities to enable them to respond to emergency situations caused by natural disasters. Timeka Rodney reporting for the HGB Nightly News.